Hi, I'm Dr. James Strubbe. I'm a chiropractic physician in Pinellas Park, Florida. Wanted to talk to you for a moment or two about some of the benefits of exercise. Now, everybody knows exercise is good for you, and everybody knows it can help strengthen muscles and bones and that sort of thing, but it is as close as you can get to the silver bullet for what ails mankind. There are essentially two different types of exercise. There is aerobic exercise, and that would be something that gets you huffing and puffing for 15 minutes or so. And then resistance exercise, and that's more like weightlifting and that type of thing. In order to get the full benefits of exercise, you really want to do both types. And if you have not exercised much in the past or at all, when you begin an exercise program, you really have to take it easy. You have to start off very easy. I like to tell people wimpy easy, and then slowly ramp it up from there over a period of a month or two. You know, there's no rush on this stuff, and it's better to take your time. That's actually one of the big downfalls for people who decide to start an exercise program. They're enthusiastic, they tend to overdo it, and then they're really achy and sore, and they say, I'm never going to do that again. So you can avoid that by starting off very easily. Now, some of the benefits of exercise, one of the biggies is that the better shape you're in, generally speaking, the higher your metabolic rate is. And your metabolic rate is kind of like what your system is running on when you're at neutral. So if you are in good shape because you've been exercising and you're sitting on a couch watching television, you're burning more calories than the guy sitting next to you who doesn't exercise at all. So there are some hidden benefits to doing some regular exercise. It's also obviously going to help strengthen muscles, but that in turn will help strengthen ligaments and tendons, and that's important. And especially for postmenopausal women, it will help to decrease the amount of material being lost from the bones, osteoporosis and things like that. And if you start exercise before menopause, you can build up a backlog, an extra supply of minerals in your bones that can be very helpful as time goes on. So for bone strength, it's also quite helpful. Exercise will help with things like sleep. Exercise will help with things like your mood. If you're in good shape, you're going to tend to be a little cheerier and more chipper. You're also going to have a lot more energy than you would otherwise. It's good for heart and lungs, obviously. But the benefits of exercise go on and on. And if you are considering an exercise program, I would encourage you to start. Don't get too carried away at the beginning and slowly ramp up into it. But yes, exercise is something that is guaranteed to be helpful, or as guaranteed as anything can be. With exercise, there are any number of different approaches to it, but in general, if you can do something 3 times a week, that's sort of the magic number, because that's doing it frequently enough to get the benefits and to create physiologic changes, but it also is giving your body time in between the exercise to rest and recuperate. So those are my suggestions for you, and I would encourage you to start an exercise program. I would also like to thank you for your time, and I'd like you to have a good day.